She's keeping up with the rest of the kids too, so.
Yeah, that's a chore. That is a
How many
chore.
others does she have?
I think
Three. Oh my gosh.
it's one of those, what have I done?
I'm not going there. I'm not going to say a word.
She's probably wanting a bunch of children care providers listed on the Sweet Home website so she can go through and get that support she wants. I feel for her.
Yep. Well, I do and I don't.
I mean, I thought it was
Yeah,
tough enough.
I mean,
I thought
they
it was a
know what
challenge just with
causes
two
that.
Like I said, I thought it was a challenge just raising two kids.
Yeah, well,
Yeah.
I think more than two
Thanks for
people
your
must want them.
It pretty much all lines with everyone else. Boy, you did a stretch on the healthcare participants. Like, button to hit us on that one.
We can get there.
I saw that and go, ooh. Well, the one thing too is you're spot on because we talked
Is
about
your wife
how we
doing okay?
campaign.
No.
And we could do
I'm
better.
sorry.
I was off
Having
and
a
wanted just
tough
have.
I always hate to
be
ask that
sponsored,
question.
but
I know.
trophy bag or
I
something.
appreciate it.
It's
but
just,
But
at
then I look
our
at
age,
each-
I
I come
have
up-
to ask, because that's,
Let you guys see that monitor.
I don't know,
Yeah, we
you
need
know,
to
the
get message
superintendent
up
of
there.
schools now. Terry Martin.
Safeway, they're
Yeah.
monitored the same.
He
there
went to
because-
Arizona
when I
2
talked
weeks
to them,
ago. His
Well, the
daughter
monitor doesn't
has
work. And I said, how
brain
long has it been
surgery
out?
scheduled.
Forever. I
Oh,
said, well, people are
He got
sitting
there,
there waiting to get a vaccination.
and they,
Black.
and she,
I said,
they
what
arrived at the
opportunity?
same time,
I said, who do I
expecting
need
it
to
would be
talk
3
to?
or 4 days before operation. I said, we can take her right now, or we're gonna have to wait 2 weeks.
Is it
oh
more?
my.
Oh,
And-
all right.
And they said,
Right, let's go
"I'm
ahead
doing
and
it right now."
let's go ahead and call this meeting to order. I'm glad Adam reminded me, and we'll go ahead and do the pledge of allegiance.
Flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I thank all of you for being here. It's good to see everyone again, minus Kelsey, which, as I said, she's at home rocking the little one. Probably trying to get some sleep in between, I'm sure. Go ahead and roll call, please.
Committee Member Horton,
Here.
Committee Member Grunts is absent. Committee Member Knowles,
Here,
Committee Member Jones,
Here.
Committee Member Schumacher,
Here.
Vice Chair Dalton.
Here.
Thank you.
Okay, get a chance, please take a look at the minutes, and if you're okay, I'd like to have a first and second on those.
I'll first it. I read them before, so.
I'll second it.
We have a first and a second. All those in favor, say aye.
Hi.
Opposed? Okay, thank you. That's a quick one. Boy, speed readers tonight. Okay, any public out there online anywhere, Adam? Nothing on the radar. Okay. What we have is Jeannie is here tonight. You are. You're on your own, but what, if you come up here, and sit, we'd like to put you right up front and center. But Jeannie's been in contact with me, talking about a program that the Western University students are wanting to
Thank you.
pilot, especially starting off in Lebanon, I believe
Thank
is
you.
right. Is that right, Jeannie? And of course, my challenge back to her was, why not Sweet Home? So that'll be a discussion after her presentation to see if we can talk, maybe discuss along those lines a little bit. Well, what she approached about is a new curriculum to help medical students learn to treat patients and interact with like cerebral palsy and individuals that experience intellectual disabilities. A way of bringing groups together and get caretakers and parents involved in a process where students have a chance to ask them a lot of questions, and so they're better prepared when they do meet face to face with individuals that have a disability of some sort. They know how to interact and interface with those. So with that, Jeannie?
Not at all.
Any questions?
Yeah, any questions? So we're developing a new curriculum for medical students.
Could you please go? Yeah, thank you.
Is it on?
It should be on, yes, but if you could just be close.
You may have turned it off. If the red light is illuminated, it's on.
Okay, now I'm on. So we're developing a new curriculum for medical students. So in the years past, I've been with the medical school for more than 15 years now.
Hard to
So
believe.
I know, can you believe that? We've been there for 15 years. And now we're smart, right? So we've always had what we call standardized patients. So we've had people in the community come in and pretend they're patients, right? So we give them a case, they learn the case, and the medical students come in and interact with them, right? So we've done that. Our new curriculum is lived experiences. We really want people in our community that have these lived experiences to come in with their caregivers, their family members, and be those patients, sort of, and teach medical students how to interact with them. So right now we're looking at cerebral palsy, and development disabilities. Later on, we're going to do autism, right? So people in the community can come and really teach our medical students as they become physicians in our communities, hopefully. I think I have five of our graduates that are now working in Lebanon and Sweet Home. Hopefully we get more.
Yeah.
Mhm.
But they are coming back home, and that's really, really exciting to see. And then when we talk about physicians in a rural community, we get all of the patients. We don't just get one population, we get all populations. So this is one population, a special population that maybe medical students don't know how to interact with. Maybe they don't have family members or communication on that side. So to teach them, for all of us that maybe have individuals that are on that side of the population, to come in and help teach medical students how to interact with them. So that's, we're piloting this. We're just trying this, and it'll be on March 3rd. So I'm kind of marketing it. If you have family members or you want to be part of that, my contact information is on the flyer. I would love any interaction with our community members and really engage medical students in learning. I guess that more than anything, learning about how to work with caregivers, learn how to work with maybe non-vocal or DD patients. Maybe they don't know that, and that's not part of their curriculum. So this is a whole new pilot project. So that's my plug for that. And I reached out to Bob first because we talked about the Sunshine Home
Mhm.
here and having our PT students come into there and work with the individuals that live there. We haven't quite got that off the table yet, but we're still working on that to have our physical therapy and maybe our DO students actually come into the facilities with our physicians, of course, and work with patients. But right now, this is more than anything, it's not caring for the patients, it's communication.
Mhm.
Right. So that's really what the curriculum is. It's learning how to communicate with our families and our patients. And that's my plug for that. So
And I really was thinking about you yesterday because I'd taken our daughter to the Samaritan Clinic. It was time for her checkup. My wife couldn't take her, so I said, I'll take her. So knowing our daughter with her disability, it's a communication thing.
Yeah.
And so, when the person that checked her in did a great job, it was awesome. Of course, our daughter carries a doll with her everywhere we go. So everybody knows the doll's name. And I'm always like, don't talk to anybody about the doll, please. Just well, that doesn't work. And so then we got into the exam room. Of course, the nurse came in and started taking her vitals and things. And for her, it was okay, Alicia's a different, but our daughter's also one that will answer yes to any question you ask her.
Yeah.
And she says, well, have you had any headaches? Yes. And I'm going, I look at her and I go, really? You've had headaches? And, and to help them understand it. And she learned in a short period of time how to rephrase a question to our daughter, because it didn't matter what she asked her. It was yes. Do you want a COVID shot? Yes. I mean, that's just the way it works.
yeah, so bring that forward to as our first year medical students are learning to be physicians, how to bring that forward. It'll take a physician a couple times to interact and get to know that patient. But if we train our students before we get into the clinics how to interact, then that connection would be sooner, right? So,
Because like with the doctor, when she came in, of course, she's picked up on the doll
yeah,
and interfaced with Alicia in such a way that says, oh, I need to check your doll's heart. And, you know, Alicia's bought in full at that point in time. She did an excellent job, but the way they interfaced, you know,
Yeah.
and each doctor is different because we've taken her to like for a mammogram, totally different situation, you know. But our daughter, when she comes through, she knew she was going to get a vaccination, but her only question was, do I get stickers? She didn't care about the
Yeah.
shot. Shot was already in and out, you know. It was just that little bit where her focus was. So how many, when the students meet, how long is each person going to meet with a student?
Great question. I had a meeting today and we're thinking no longer than an hour because it's a lot of anxiety for our patients to be with that many
Right.
people. We did talk about the timing. We're going to have some of our lived experience patients in just the clinical skills, just the communication, and then we'll have some of them that will actually be able to do OMM, which is the manipulation treatment. So we're still flushing that out. I'm looking for probably 8 or 9 families to come to the medical school to help us with this curriculum. Some of them will opt out of doing OMM, the hands-on treatment. Some of them will opt into that. So we're kind of managing that right now. But that's really going to be up to the families and the patients, whether, and I told the staff today, that's what we need to learn. On top of caring for our patients, we need to learn their boundaries. So if we have patients or families that come in and say, yeah, I want to try OMM and they don't really like it, how to get them out of that so it's not traumatic and scary. So we're still working on those pieces. Again, this is a pilot program. We've never done it. We're hoping to continue to do community member lived experiences as we teach our medical students. So I'm going to say, I think at one point today they said an hour and a half, and I said, no way are we going to be in a room for an hour and a half.
Too long.
And no way are we going to be in a room with an hour and a half with 6 people. Like we'll have a couple students, we'll have a physician, we'll have the care facility, the DSP, we'll have the patient. So we have to think about all of that organization in order for the patient to be comfortable and for the DSP or care person to be comfortable.
So now will this be all in the same room or these are different?
We have different, there be doctor offices room.
Okay.
I have 8 different doctor offices rooms, and then we have the OMM lab. So we'll have, the patients will be separate. We won't have them together.
Yeah.
Yeah.
Which
So
privacy for one thing.
yeah, privacy for one thing, and then
Them being comfortable because of all the different aspects of personalities,
Yes,
they just
you
may
would
not
never
connect.
come into the medical school, like
Yeah.
that's a whole
Yeah.
different environment,
Right.
right? So
Yeah.
that comfort.
Scary.
That
and
anxiety may be
yeah.
there a little bit that you have to recognize.
So
Yeah.
a little bit of that. And we did talk about doing the hands-on manipulation for individuals that are in wheelchairs. We're not teaching transport. So we give them the opportunity to do OMM hands-on treatment in their chair if they choose, or they have to transport or have somebody transport them to the table. So we've talked about all of the logistics around that. But that's where I need all of you. Like, how can we make this curriculum beneficial for our community, beneficial for our patients, and beneficial for the medical students moving forward?
Yeah.
And then what other populations are we missing? So
You're thinking first year students?
I'm thinking maybe first and second year
Yeah.
students.
Okay.
Yeah, we only have students in our building for 2 years. So I believe this might be a second year curriculum, but don't quote me on that.
Okay.
So now once you went through this program, well, what do you expect to do with this data you're collecting? What are you going to do with it? I mean,
We're going to make amazing curriculum.
well, right. But I mean,
Right.
try to massage it into some sort of a training program that you can share with other students that are going to do the same similar process and,
Yeah, so
um,
we have piloted this program twice on our Pomona campus. We weren't bringing it to Lebanon until next year, but our Lebanon students said, why not us? So we brought it quickly. And yeah, it's going to be a curriculum that's going to be developed across medical schools. Like bring your community members in, their lived experiences, their communication, like all of those things. How do we make this beneficial for our patients?
so, just a little bit further on this one, of course, you got this little handout flyer here,
know,
but
I
how are
just
you
wanna
really
read
getting this out to the public to know this?
These are my first audience.
Okay.
So I have talked to WVRC in Lebanon. I have 2 families that have like already contacted me that they're interested from that. I talked to the Lebanon High School Welcome Center with the Brick House.
Mhm.
And today in my meeting, I asked, what is the age range? Right. So I really wanted to know that, but yeah, there's no definition on younger versus elder. Like we just
So
want
you don't
all
have an
ages.
age requirement of
No,
any kind?
no
Okay.
age requirement. As long as they have the support, the care facility, care person, DSP or whoever's with them, then the age won't matter.
Yeah.
As long as they have somebody there to talk for them.
So I had pushed you a little bit because I was like,
But
just a little bit I did, I think in the phone call. It was the idea of the possibility of us having that here in Sweet Home at some point to let this committee help you drive that, because I know there are those families here in our own Sweet Home area. And
Yeah.
Sunshine's a good example. And they're not just the ones that are at Sunshine necessarily are just from Sweet Home. Some of them come from Lebanon
Yeah.
to Sunshine. So you've got that population there. But I also know that, it's important, not only from the aspect of the doctor meeting with the client, but also the parents and the caretakers is a key, because they're all different ranges.
yeah, and I've talked to a lot of care providers over the last couple weeks that I've been asking about this. And it's that like maybe the patient isn't vocal, or I as a care provider see this change, but the physician doesn't listen to me. Like this is the way they did it yesterday. This is the way they're doing it today. So there's something different. And I guess that's where I'm in the kind of in the mindset of that communication. Like our doctors come in and they work with the patient, but our doctors can't only work with the patient. They have to work with everybody around that patient, especially with this population, right? So opening that communication and that education is hugely important, not only for my school, but any medical field. So my hope is that instead of having pretend patients and trained actors, we can have lived experiences and really dive into learning how to take care of our community.
And as is typical, you're ahead of me. I grew up in a town that had a school for the deaf, and a similar kind of idea was there, and I would present to you both blind and deaf are similar kinds of issues, which you can put on a back burner or do whatever. But one of the issues was that it's hard to find professionals who can do that. You're training a small number of folks, and that community starts to expect it, and it becomes a challenge. So and it's probably the last day of class, but pass on to them that part of their chore is to pass it on to their fellow practitioners. Some of the subtleties, take on the population, volunteer to, if you have someone that comes in, I'd be glad, I'd try to help, maybe not glad to help. But over time, that's kind of problematic. It's not insurmountable, at least in my experience. But as you're getting started,
Yeah, and this is our baby, right?
Yeah.
So this is where we want to start. And I've talked to a lot of care providers for nonverbal autistic and they do a lot of sign language. So we're learning at the medical school how to recognize the sign language, maybe not how to communicate, because that might be different, but how to recognize that sign language in our nonverbal patients.
Right.
And that'll be the next piece of this curriculum. Like it's going to build on itself.
Yeah, it's really training, just like
Yeah.
everything else.
Yeah.
And,
Yeah. And we have to start somewhere. And I'm
Yep.
really excited that we have an opportunity to bring in community members to really help, I'm going to say help train medical students, not the paid actors that we have, but the real community members that really have to go to our physicians, our rural health physicians. They treat all of patients,
Yeah.
right? You don't get one population.
Yeah.
So how do we teach our doctors that we want to have them come back here about all the populations?
And I'll
then
pass on the other subtlety is how much, how positive this is to the patient themselves.
Oh,
They
yeah.
feel like they're just important, you know?
Yeah.
Those people are learning from me.
And we've heard
It's what
a couple of
Bob was
those
talking
stories.
about.
We've heard a couple of those stories. Like
Yep.
they go to the doctor after this communication visit and they feel more comfortable.
Yeah.
Right. So
They're in control.
yeah, we've heard a couple of those stories, and the patients love that they get to be the teachers.
Yeah.
That they're like, I'm part of the equation, which is super important.
So is this a one-time thing or
Yeah.
do they do it multiple
One time.
times?
So far, it's one time. We're doing it during conference week. It's March 3rd. But we're going to continue to do this. It's a grant that we have, grant funding, so that all of the data and research will move on to more grant funding moving forward.
So if we know a family, we can tell them it's going to be a one-time for an hour, hour and a half.
Yep, one time for an hour and a half at the medical school in Lebanon.
Okay.
And then, like Bob said, maybe we can bring it up here and do it here. But
I think it'd
We're gonna
be
keep going.
awesome to see your first round and then bring it here just
Yeah.
for the idea that we do have a population here
Yeah.
that would cater to. As I sit around thinking, can I go because I want to get over the white coat syndrome when I walk through the door, my
Exactly.
blood pressure goes up, you know, so if you can
mine
talk
still
me
goes
down.
up and I wear a white coat. It's okay.
Yes. Anyone else have any questions for Jeannie before she? Well,
No.
thank you for being here and sharing that,
Absolutely.
and you and I definitely will stay in touch. I'll be interested to know how it works out, and maybe later on in this year or something, we can look at that as a group
Oh,
to
yeah.
maybe hold
If we can
some.
bring students here.
Here,
So,
yeah.
Yeah.
It's good to see the different populations. You talk about people with disabilities, but then I also think about the senior population, because I always remember taking my mother to the doctor at 87 years old, and that was a real process for a doctor to interface with her, because I'm like, Mom, that's not what they ask,
I'm doing
So
a journey right now.
yeah.
Side note, medical journey with my mom is really cool because all of her doctors, even her cardiologist, is one of my graduates.
Oh,
Wow.
So it's
Awesome.
like
Good
nieces
job.
and nephews that don't really grow up yet.
Mhm.
And you walk in and it's like, wait, I know you.
Yeah.
I can't believe you're a cardiologist already. So it's really, yeah, the medical journey is one thing, but watching the kids, I'm going to say kids, go to school here, become professionals here, and come back and work here is super amazing.
Imagine how tough that is on the doctor. I know.
I know. Yeah, there's been a couple of them, and I'm like, I know this is weird, but can I give you a hug?
Yeah, exactly. I almost flunked your class.
Good thing I didn't fail you. Well,
Thank you,
for
Jeannie,
your
for
time.
being
Thank
here
you
and your
so
time.
much.
Sounds like a pretty neat
Great program.
Yeah,
Thank
good
you.
for
Good luck
you.
with it.
Good luck.
Congratulations.
We'll stay in touch. Okay. The next item on the list, I guess the old business is Samaritan Health Labor and Delivery Update. I don't really know much about what's going on
I
there.
just included this. It feels like old news now because we haven't met for a while, but back mid-December, I did include a press release in your packets that Samaritan Health would be suspending labor and delivery services due to workforce shortages. And so I just know that's been a topic at this committee and just wanted to keep abreast of that. And I did search. It doesn't seem like the situation has changed unless someone has heard differently.
No, I think, for what we're seeing in the media is about probably what we all know at this point in time in the public. So, all right. Well, thank you. Next item is the communication board update, and I'd ask you, Cicely, to tell us a little bit about that.
Yes. So to date, we have raised $25 through the GoFundMe and received $850 in direct donations. So that's a total of $875. We are still $1,625 away from our goal, but we have made some progress. So if anyone needs more flyers, I can get those to you. Just please share that with your networks. And then I'm planning to add it. We started a monthly newsletter for the city manager that goes out monthly through our website and through Facebook. And the upcoming month is all about parks. So I'm planning to tack that one on. So.
Yeah. Well, and I'd ask the committee members here I think we can get behind this. I mean, some of these contributions I went out and got. So it's just a matter of asking and finding. But I think, that supports our mission, supports the park and the city as well. So, $1,625 away is what you said. I think that's very doable. My idea was I'll probably get with like Mike at the Point Restaurant, see if we can't propose some more flyers out there so the community can see it. What about Scott in the newspaper? Would we go with him on that?
We can, but we do have to pay for advertising, and it is actually very expensive. Especially an ad like that is color and detailed. The size we would need for the information to actually make an impact it would offset a project of this size. Probably not a good ROI.
So could I, as a letter to the editor, asking?
I cannot advise you on that, but you are a private citizen, sir.
That's just what I want to make sure. Anyone else have any comment on that?
Oh.
Expect a check from each of you before you leave tonight?
Question,
Pass the hat.
question.
Yes.
Refresh me, what in particular this fundraiser is for again?
Now I'll let you go ahead and take that.
Sure. So it's to install a communication board at Sankey Park. So basically,
Okay.
it is for nonverbal people, and it has, there you go. Adam has a picture on the screen. So basically,
Okay, that one, yeah.
yeah, it has
Yeah.
letters, numbers, and then relevant imagery so that people who are nonverbal can still communicate and participate and have fun.
Okay, now I know. I've seen this one before. Thank you.
Well, I think too, each of us has a possibility to make that difference. And, if it's, somebody that's that, pitch it to them. There's people out there that this is a good time of year probably to go after some businesses and stuff because last year's over, their giving is over. So this is I kind of look at it as a new start at the front line. Get in there first before someone comes along and asks them for something. So,
Yeah.
so all right. Thanks, Cicely. I appreciate that. Community outreach. I just see everybody's real quiet about that, but the one thing on the community outreach is for this committee to start looking for opportunities such as like with what Jeannie's doing, outreach into the public. So one of our goals, as a committee is to educate our community and educate our leaders. And so outreach doesn't necessarily have to be, outreach could be to the city council, our leadership, and educating them in processes and goals. Outreach, obviously we do the health fair each year. That's an outreach program. It's like, how can we extend that? And I know Wanda here's definitely put a challenge to us there to increase the size of that. So that's a good thing. I know, Larry, you sent me a flyer for an outreach for people that are in crisis and disasters and that, how do we outreach to those individuals? So those are the kind of things I think that we as a committee will end up putting on our goals for sure. Some other opportunities that we can do those outreach. In fact, I talked to Scott Swanson at the newspaper. is there an opportunity for the newspaper to kind of showcase some of our articles and things we're working on? And he was very supportive of that process. In fact, I talked to one a little bit because we were talking about the outbreak of bed bugs, for instance. How do we get that word out? I mean, we just had the conversation about it, and Scott was ready to jump on it. But it's connecting the dots to make that happen. With Jeannie and their project, can it go in the newspaper with Scott? And Scott's willing to step up to that. So I really appreciate his support for this committee, going forward. Outreach as well. I've talked to Ken a little bit when we talked about, is there some festivities, there's things we can put together to outreach more and incorporate. Also how we outreach to the parks group, because parks has been a big thing. We don't necessarily look at parks as a health thing, but it is a health thing. It's getting the healthy minds and people exercising outdoors. So it's a mental health, it's all in the bundle. So the communication board, outreach. So be thinking about that, because I'll be talking with Kelsey more, and we'll challenge this group to make sure that we have some of those kind of projects on the board for this committee.
If I may.
You may.
I just want to thank Wanda for connecting Rotary with Catherine Rupkus. She presented her program probably about 3 or 4 weeks ago on suicide prevention, and it was wonderful. She really generated a lot of interest, I think, from the group. There's a 1-hour training apparently that is available that the county actually is right now offering that in different places. And I'm just wondering if maybe we shouldn't be contacting the county, asking them to come do their.
Wait until the end of the agenda.
Yeah.
Oh.
They're on the way.
So another outreach, and I really appreciate that. And I know Rotary is always looking for programs. So if any of you have programs that you would like to reach out to Rotary with, we have a pretty diverse group of people that attend that most of them have a lot of impact in the community. So
yeah, the suicide program was great. The slide presentation was good. It's just that you got a time frame, and she had probably more information.
Oh,
we really didn't get to
you
the.
need the hour.
You actually need the whole hour. So, but once I saw the presentation, I thought, this is just one group. There's another group of people we need to be taking the same program out and getting it out in there more. So I've actually asked her to share her slide presentation with us so I could bring it to the group and let them look at that we're not there.
That'd be good.
But it had good information. I learned some things there that I was unaware of. And yeah.
Well, it's a topic that most of us, I think, want to avoid, where we really shouldn't be. It's one that we should probably be stepping up and talking more about.
And it's just like the mental illness aspect of it. All goes along with that. It all ties together.
Sure it does.
Because I was sharing, with the group earlier, just what I'm personally going through with my wife with depression, based on where I'm at with my health, It definitely had me take a look at it from a different set of eyes.
Yeah.
And I think there's a lot of opportunity out in our public to reach out to groups, invite them maybe to the senior center as a public thing, and let people bring those thoughts and information to us so we can share it with them so they feel that there is light.
Yeah.
Look up and there's some light. But it's just navigating the process is frustrating for people, so anyway, anything else on that community outreach?
The only other thing I might want to bring up again, I talked a little bit about last time, is that emergency preparedness. This time of year, especially, but even in the summertime, emergency preparedness as far as cold weather events, snow events, people with families, like people with disabilities, what do they need to do to get prepared? And that group that talked at the presentation I went to in Albany, they were pretty good, and they had some exercises they had us do and stuff, but it really just talked about what individuals can do to be prepared.
Yeah. I was kind of thinking about that. We do the kids backpack program. It's kind of a little flip to it, but I was thinking about what's happening back east with the cold weather and the amount of deaths they had of people being exposed. And I was kind of brainstorming in my head, is this committee a committee that could put together those kits
Mhm.
that you can give to people. It may be hand warmers. I don't know.
Mhm.
Could be a first aid kit,
Yeah.
but some things and some information that we could probably put together and give out. You know, if it's 10 of them or 20 of them or whatever, if we walk around and give them to them, it's definitely going to have a positive impact. So
Mhm.
thank you. I appreciate that. The next item down there was City Council Goals Committee goal setting. One of the City Council, when it comes to the City Council, what I was looking at, Ken, is I know the City Council is going to be setting their goals for the year. I think that's coming up in is it April?
It's coming up at the end of February.
Okay, with that in mind, well, that's not a problem. What I had thought of is, as a committee, I'd ask for people for input, and I've got some of it. Some of it's you'll see here. I think you gave me a handout came from Wanda. The question I was asking about, you know, what have we accomplished as a committee, but also what do we want to go into next year? But one of my ideas was City Council is always focused so much on budgets and things like that, and is health a part of the conversation? And my thought was to take what a healthy community is, and I've asked this group here to put that together, what that looks like. And I would personally, probably Bob Dalton, unless someone else wants to do it, but either attend their goal setting session just to kind of give a little preempt of here's some things to look at, maybe at the city council meeting as well. My thought was is set, you know, these is what makes a healthy committee. And as leaders, you have the ability to have an impact in that. And, you know, if they don't really look at health in a way to understand what they're talking about, you know, that's us to educate them in that. It can be, they're already doing it like with clean water, working on clean water. That's a health thing. But, you know, neighborhoods that are clean without garbage in that creates a healthy community. And I think those are things that if we educated the council on, that they would incorporate maybe one of those ideas or put their head wrapped around and say, oh yeah, we could do that. And it could be with the help of us to help achieve that goal as well. But I'm thinking that's a good opportunity because we're doing some things that other cities don't do. We don't have health committees in every city like this. You know, they rely on the state or something like that. So we're unique in that arena. And I think that expands our growth, but it also expands their growth as well. To look at parks is another example of what the city's doing really well. We're developing parks. So I think if we educate the city council to look at it from that perspective, then they'll connect that dot, I think. Does that make sense?
So just to clarify in terms of goal setting process and set expectations, like City Manager Ogden said, we are going to have 2 goal setting sessions this year, same as last year. The first one is going to be at before the last city council meeting in February. This committee, if you want any input, you ideally need to have that to us before that date. There is no public input at the goal setting session because it's a work session, not a regular session. If you did want to provide input, then I would encourage you to come to the public comment period at the next city council meeting. Yes. And if we need to have a separate work session, because your next committee meeting isn't scheduled until the day after goal setting starts, at which point it will be too late, because that first goal setting session, they're really setting their final list, and then we're refining as staff. So there's no really opportunity for something new at that point.
So your city council is what, twice a month?
Mhm.
And it's usually on a Tuesday, correct?
The second and fourth
and
Tuesday.
fourth. So
Mhm.
if we put together just the handout
Mhm.
piece of it and came to the 15-minute, or well, what is it, 5 minutes now?
Three.
Oh, I thought maybe we were up to 5.
Yeah.
Doggone. I'm gonna have to send somebody else because I can't hold it down.
If all 7 came, then you could have 21 minutes.
Yeah. No, I think that's workable for us, just to put together, here's some ideas, and I could just deliver it real quick and hand it off and then go from there.
Mhm.
See
And keep in
where-
mind, you have a
Yeah.
council liaison too. So if you arm
Yeah.
him with that list, he can bring that into the goal setting work session as well.
Okay.
Yeah.
That's
That's better.
That's what I was just thinking of here was from a counselor's perspective, and especially since I'm the liaison between the two, give me the bullets. Short, concise, this is where we're at, this is where the health committee is coming from. Then it's something I can put for the rest of the counselors. It's right there. We can be ahead on these things. I want the council to be thinking of what the health committee is for. Unlike what we did last year, where we went, council totally disregarded any input from the health committee. I'd like to see, let's be ahead of it.
Mhm.
And let's start with some, the bullets, something short, concise. You could give it to me and I present it, or you can do it like two people, one does half, one does the other half in 3-minute shots. There's no rules against that. But the main thing is get the message, to
Mhm.
council as soon as possible.
I'll hook up with you then.
Okay. Yeah.
And we'll get that put together off these individuals' input. And then you'll be able to go with that with them. So now on the other part of that, now this committee has to give a presentation too. And when is that due by?
So technically, I think April 1st, but
Okay.
as long as it's around that time. Again, you guys are really the only committee that's compliant with it. So.
No, I think that's doable. I'm glad we fleshed that out because I wanted to make sure the process was right. So if I just get that to you, Ken, then you're off and any of us can attend the city council meeting, just there in the back and.
Oh yeah,
Correct.
work sessions are open to the public. There's just no public interaction.
Yeah.
So it's not like we could do a
Okay.
Q&A or anything. Yeah.
All right. Sounds good.
It could go as, something into the counselor's packet, but from a counselor's perspective, who is very much pro-health and pro-health committee, I'd like to see it as a written document, in the packet, as well as members from the community speaking out in behalf of public health. So that's where one or two of you could take part. Then it's a two-pronged approach.
Okay. Sounds good. I think we got that.
Okay.
And again,
Straight
I would encourage that to take place at the regular city council meeting on February 10th, because that's the only opportunity you'll have to go on the record before goal setting starts.
So the February 10th, you're talking about a member coming there and just do the 3-minute. Okay.
Or 2 members at 6 minutes,
Yeah, you could do that.
or
too.
3 members. at
So
9
would that be
minutes.
the same thing that we're talking about though?
Yeah.
Okay.
Mhm.
I think we can do both.
Yeah, I think-
I put it,
Yeah. I think Councilor Bronson is saying the public on the record stating as a committee member you're supportive of a health-based goal is great, but then yes, if you can also provide a document, if I get that in advance, I can include that in the goal setting packet as a referral.
Sure. Putting the heat on me now.
exactly. Last year, the key thing, I'm not going to go into details, but we got totally outmaneuvered. Can't let that happen again.
Hey, we live and learn.
Yeah.
We adjust our sails. So anything else on that? I'm sure Dick, you'll be glad to go there and do that, won't you?
I didn't hear that.
That was a laugh. That's a yes. I get it right there. So,
And
okay.
I do have one other comment.
Yes.
This is an even year, election year. It does not cost the city of Sweet Home to put a ballot measure before the voters.
Okay.
Fill in the blanks.
Still in the blanks. Back up a little bit on this. When we talk about the community outreach, I thought of it in our discussion here as well. One of the things, we're kind of unique because I asked Cicely if we had any money left in our budget, because we usually have a budget of about $1,000 a year and we never spend it. But one idea I thought was using those funds, because we're up until June, to as far as community outreach, we always put out the signs for some mental health, but I would think that with those monies that left, and just think about it, that we could use those maybe to buy some additional banners for other health related items that we could actually put out in the public and bring their awareness to whether it's breast cancer, whatever that would be. Put some thoughts about what you think as a committee, a message that we would want to send out. And it could be some things we could even buy ahead of time to use at our health fair too as well. So think about that, put on your thinking caps, and I'll reach out to you some further on that one. I know Wanda's already thinking, I can tell. So, okay. Committee business for the good of the order. There was a suicide prevention training, which you mentioned we talked about. So I think we've kind of covered that one. But
did you feel like you covered city council presentations? I had that one after goal setting. I just want to make sure.
I think so.
Okay, great.
I think that's kind of hand in hand with the other one. I did ask for, and I have to get it put together. I just kind of been busy, but I did ask the committee here to provide me with goals they wanted for next year and what we've accomplished for this last year, so I could put those in a presentation, especially our achievements. So the reason I gathered that information, so when it comes time to give our presentation to the city council in April, I'll have that very clearly spelled out as to what our plans are. But prior to that, I'll make sure I take this data, crunch it together, and bring it back to a meeting here and present it to this group so he could yay or nay and make sure we're good on that. But I do appreciate those input, and I'll probably bug you some more about it. But everybody was pretty much on the same page when it came to.
Is this your document or Cicely's document? This is, okay, thank you. I just didn't know who to
Well,
give
the only
credit.
thing I saw there, she said increase the health fair attendance by 1,000.
Yeah,
And my heart rate went up.
To 1,000.
we don't have a venue.
Well, that's,
My heart rate went up.
We
My
can do it.
blood pressure. Well, that's been a challenge for us anyway, because, a community doesn't look at health as we're going to a health fair and we're going to ride on a roller coaster and, do some things. And it's different than, the Oktoberfest. I mean, they've done such a great thing in that arena, the Parks Group, bringing that together. And that's a lot of vendors in that. So for us, it's a challenge.
We're going to have to move to the football field.
Yeah.
Can you imagine 1,000 in that auditorium? Woo.
No, I cannot.
no,
So,
it's pretty packed the way it is.
They were, that's what I mean.
but for those that provided information to me, I appreciate your input. And again, the common ones will fall in place. So with that said, anything else?
I just to plug more details, again, the suicide prevention training is being hosted at our public library in March. Registration is required, but everyone is welcome. And then something I forgot to put on the agenda, but just to give you guys a little heads up, we are working on a grant application to install a fitness park next door in the park area there. So fingers crossed and to be continued. But as we move through that, we may be asking for a letter of support. I don't know yet if the application will allow it or require it. If not, then if we get to the point where we're asking council to support it, then you're more than welcome to come testify to that as well.
I think it's a great idea.
Yeah.
If we could help get behind that, definitely would support that. So
I think
Great.
all the parks should have something like that.
Yeah.
Nothing that costs lots of money, but
Well, they do.
Yeah, they
No,
do.
I'm saying,
Yeah.
These things
yeah.
do.
Yeah.
some that don't.
Yeah, I'm not aware of any that don't.
There's not much that doesn't cost a lot these days.
Really?
So,
Yeah.
yeah.
Just a chin-up bar, 2 pieces of
And-
metal?
Yeah.
Well, so this one is actually designed for like multiple ability levels and can be scaled. So we really wanted something, again, that's inclusive of lots of members of our community. So, but that does come with additional costs because there's engineering and all that good stuff. So
Could you expand a bit on what exactly you mean by a fitness park?
basically it's designed, well, it's two halves. So one half has different stations. There's like a QR code and instructions on physical activities you can do at various fitness levels, strength training, cardio, resistance training, all that kind of thing. And that's on one half. And it's basically circuit training. And then on the other half, it's essentially just a flat, improved space, but we can host outdoor fitness classes. People can do yoga. It's just a nice gathering space for the community. And then there is an art component in the middle.
So where is this now?
So this would actually be in the green space next door to City Hall.
Thank you, Cicely.
Thank you.
Thank you, Ken. Anyone else have anything?
If I could back up just a little bit, back to the QPR, just to remind folks, the county folks have been here at the high school and other levels, always well attended. They're spreading out to other cities. I'm part of the Mental Health Advisory Board, and they're doing Harrisburg and I think SIO now. And what's happening, and I just bring it up to remind people as you think about where to encourage them to show up. They'll show up at the high school, teach the kids maybe, and then they'll get to the teachers. And suddenly a bus driver will say, wait. And they actually taught the bus drivers here a number of years ago.
Yeah.
And that's turning out to be true in other venues as well. I was thinking about the senior center. So you do it for the senior center staff. The libraries turn out to be very important. I remember during the COVID issues, the library here suddenly turned into a mental health facility. I mean, it continues to act that way. And you're asking people that have no training in this kind of stuff to really be helpful. So there are ways to branch this kind of stuff out. We could use the help of the city to help find places to do it, but just kind of broaden your thoughts about this. The county's more than willing to come out and teach at those things.
So has any of the city staff received the training that he's talking about?
No, not at this point. I mean, we're welcome to attend, but no, we haven't done a staff specific training.
Is that something that the police officers would benefit from having, I would think?
Yeah, they could benefit from that. Again, it comes down to, budget
Training.
and scheduling, and so.
Yeah, it's the
Yeah.
training time,
Yeah,
probably.
it's a fairly short class, and it's an overview. I've been to 3 of them now, and each one you learn something different about a particular community.
Is it an hour long? I mean, roughly?
It is an hour long. We've attended it. All of our staff have attended it at the clinic.
They'll stretch
And
it
it's
to-
worthwhile, and I would advocate for any citizen to attend it.
Yeah.
You don't have to be a medical person or a
Yeah.
police officer or a school teacher. It really is usable information for anyone. And it was 1 hour.
Yeah.
They'll stretch it to 2 because people talk too much. But
Okay. Last note on backing up about funding for some of these things too. I look a lot online, looking at different organizations that do have funding available. And I just turned the library on to one. It's actually a Portland-based. Oregon Humanities is a big thing in Oregon, and I look at them a lot, and they have a lot of special funding available, $5,000 ones, $3,000 ones. A lot of theirs is based on if you're putting programs together for educational purposes into your community. So, don't think that you just have to do it yourself and pull it out of your own wallet, but just think there are a lot of places out there. And I look in every place. I don't care if it's DuPont Paint or Bi-Mart. I ask. I mean, Bi-Mart gives you stuff. It's just a process you have to go through. So I always think that look outside that box a lot, because like I said, when I walk into the store, every product on the shelf to me has some sort of a phone number to it. And I've used it a lot over the years, and I get a lot of good feedback and stuff from people that you would just never think of asking, So anyway, anything else for the good for the order? If not, I'm going to call this one to end. Thank you, everyone, for being here.
thank you, Dr. Davis.
Yes.